We are back here on Healthy Living. We are here now, Dr. Andrew Krieger. It's so nice to see you after a long overnight, I understand. We've had a lot of fun talking. You have a new baby on the way, which is kind of exciting.
It is.
So thank you for coming here. This is sort of your stomping ground. I have a couple of questions that I would love to ask you. And the first one is, I'm not real clear about the difference between an urgent care and then a standalone emergency department like Tidewatch. Can you share with me a little bit about the differences or the nuances?
Absolutely. So people have obviously been experiencing emergencies since the dawn of time, but the way that we provided for those emergencies has really evolved here, particularly in the last 50 years. The purpose of a freestanding emergency department is to fill the gaps in care that a hospital otherwise would not be able to provide. So for this facility, for example, the nearest hospital is about 7 to 10 miles away.
Okay.
So with a growing community, a freestanding emergency department can provide for those emergencies for the community locally.
So location is really imperative. I notice as I'm driving down 170 that you are located in between a lot of burgeoning and new communities. And so what I hear you say is the access is amazing. You just save people a lot of drive time and potential time when they could really get sick.
More drive time, yes. We are able to more easily and rapidly care for the community's emergencies.
Who typically would come? How would I know if it's appropriate for me to come to the emergency department here at Tidewatch?
Great question. An emergency is different for everyone. Emergency department, as opposed to an urgent care, is capable of providing for a more broad scope.
Okay.
So, for example, we have a full suite of services that you would typically expect from a emergency department attached to a hospital.
Yeah, even just looking at this, I feel like I could be in a university hospital room right now.
Correct. Yeah, you're standing in one of our trauma resuscitation rooms. So, as opposed to an emergency, as opposed to an urgent care
right.
that you may find out in the community, we have a full suite of services available, including ultrasound, CT, respiratory therapy, nursing. We're capable of providing for any emergency.
Let me ask you a technical question. I'm going to be 70 years old, and I talk to people all the time about would I go to the emergency department if I didn't feel good. I think sometimes we get embarrassed to come in if we don't feel good. Maybe I feel like there's weight on my chest. It's 3 in the morning. What is your recommendation when you're talking? Because you said emergencies are different for everybody. Mm-hmm. What do you say is a get your behind in there?
Emergencies are different for everyone, but if you feel that you're having something like a heart attack or a stroke, that's not something that you would want to go to an urgent care for. That's something that you should go to the closest emergency department or even call an EMS service to come to the hospital. Talk
to me about that. What about parking? What about ambulances? I can call the EMS and they will bring me here.
Correct.
Yes?
We do have ambulances that come to Tidewatch Freestanding Emergency Department. You are more than welcome to walk in the front door as well. We see anyone that walks to the front door regardless.
Oh, do you?
Yes.
So you see the staff. I got to sit in the waiting room as we were waiting to begin this, and it was really interesting because I had an opportunity to really observe what was going on. And a couple of things I noticed that I think you'll be excited about. The staff was amazing and very welcoming to the people that I saw that were just scared maybe. And then as we walked back through, you're fully staffed.
Correct. Yes, we are fully staffed, and you'll notice that everyone from the moment that you walk into the front door to the moment that you're back in the room to the time that you're discharged, we're happy to be here. We're part of the community. We want to make sure that you're leaving here happy and healthy.
So typically what would happen if I would come in, I get an assessment. Can you take me through what it would look? We looked at the triage room. Mm-hmm. We would determine what's going on, and then what would happen?
So typically someone is triaged in the front of the emergency department. You would walk in, you would present yourself to the front desk. They would take your complaint, have you triaged, and then subsequently move you back to the treatment area, so one of these rooms. From there, you'll be evaluated by the provider, have any appropriate testing ordered, determine what we need to do to best treat your emergency, whether that's be admitted to the hospital, which we can easily do from this emergency department.
Okay.
Correct. We can get you admitted to the hospital in a timely fashion. or whether it's safe to actually go home, in which case we'll write you for any medications that you need to get feeling better.
You may not have had any sleep, but you are an amazing person to chat with. Thank you so much for joining us here on Healthy Living here today at Tidewatch Emergency Department.